Brittany was born a normal child. She had no problems with birth, with anything, up until she was 3. And she started swelling. And we discovered she's allergic to all kinds of things. She's allergic to cats, she's allergic to bees, she's allergic to peanuts, she's allergic to you name it. When he did her skin test, he said, let me put a star next to the ones that aren't that bad.
She would have increasing respiratory distress with her tongue swelling and closing of her throat. They continued to worsen, and at that point is when I referred her to see the allergist. I had diagnosed her as having hereditary angioneurotic edema.
20% of the cases, and this is a rare disorder, about 1 in 30,000 maybe, incidents. In her case, there was no family history, so this was likely a spontaneous or a new mutation in the gene that regulates the protein in which she was deficient.
One moment I'd be playing outside, and the next moment I'd be crying my eyes out in the bathroom, and then it was horrible.
Dr. Abramson, he had a previous patient who has had this. So when we came to him, he knew exactly what he was looking for. He knew exactly what to test her for.
Her case was quite severe and really affected her quality of life significantly. Fortunately, there have been some advances in the treatment of hereditary angioedema that include replacement protein therapy. I recommended for her to be given regularly, and she needed to get this twice a week because it has a relatively short duration of activity.
She has to have a port, and she has to be at the hospital twice a week and spend a matter of time, while the effusion is occurring. It's a big change in her life. It's a difficult time in any person's life going through adolescence.
I used to be scared to wake up in the morning, and I'd run to the bathroom and go check my face or feel my face to see if it's okay.
Now with the medicine, oh my goodness, it's like a relief. It's a miracle. She doesn't like having a port. She doesn't like that we have to come to the hospital twice a week. Compared to all the pain and everything she was in, it's a blessing. It wouldn't be possible for us to stay in San Angelo and still do that. We would have to move to a bigger city.
Even if they want to take a vacation, they still have to make sure that she gets her treatment twice a week. But at least that's something that we can offer here in San Angelo to her, that she doesn't have to go out of town. I can't imagine her having to go out of town twice a week. I don't know how they could financially, I don't know how she could physically, I don't know how they could do that. So thankfully, because of Children's Miracle Network, we can offer that treatment here to her, and she handles it great.
Her attitude and just the family response speaks to the strength of the family and the fact that they are a miracle family and a miracle child.
Please support Children's Miracle Network.
And help a miracle kid like me.